A very good evening. You're watching News 9 Facebook Live with me, Adarsh Wepachedu. Could there be an answer to COVID-19 in the bodies of those who have lost their lives due to coronavirus? Researchers in London feel so. So what the researchers have found is that there is a certain type of gel that is formed in the lungs of those who have lost their lives due to COVID-19 and respiratory failure. Now, the active ingredient in this jelly can be key to various new therapies to combat COVID-19. While previously we did not know where this jelly originated from, now we're beginning to understand more and more about it. This jelly consists of the substance Hyaluronan, which could hold a lot of answers and solutions for us when it comes to dealing with the COVID-19 pandemic. Now, to discuss more about this wonder jelly, if I were to call it, and whether it could be a potential therapy, we have with us renowned pulmonologist Dr. Paramesh joining us live on the program. Many thanks, Doctor, for speaking to us. Please tell us more about this jelly. I'm given to understand that the presence of this jelly is normal in the human body and it has various characteristics, right from being a connective tissue to wound healing. Could this be a replacement for plasma therapy that has now been proven that it doesn't really work that well?
Yes, it's good to hear this good news. As a matter of fact, this is the chemical called Hyaluronan, otherwise called hyaluronic acid. It is a chemical normally produced in our body for the cellular integrity and the collagen development. In addition to that, it is a lubricant for all the joints.
Okay.
It is helpful. It is normal, as a matter of fact. And also, finding it out, one of the relative in the lungs is called surfactant. Chemically, they are a little different. The surfactant, if they're deficient in that one, that will produce a layer in the lungs. It's called hyaline membrane disease, olden days is to call. The surfactant is distantly related to the hyaluronan, what we found out. And so that keeps the air sac open, so that gets more oxygen. Hyaline membrane is formed, the oxygen don't move at all. And carbon dioxide 20 times faster, it will move faster. So whenever the deficiency of this related chemical, we give the oxygen higher percentage from 20 to 30, 40, 50, 100%. If it doesn't work, we give the oxygen under pressure, we call CPAP. If it doesn't work, we have invasive ventilator. If it doesn't work, we have ECMO. Just like a dialysis, we give the oxygen, giving the rest to the lungs, give the oxygen outside and circulate it. So this chemical has been identified in the lung, which is helpful indirectly to the surfactant to keep the air sac open. And how it can be utilized for the lungs is something a clinical trial has to be made. Some more research has to be done to be put it into the lungs. Because joint orthopedic surgeons, they have been using it for over a period of time. Maybe we have to learn from them how they are being diluting, giving to the joint. But there is an enzyme in the body. It is also produced. It's called hyaluronidase. That enzyme decreases the activity of the hyaluronan because body is always a balance.
Correct.
Homeostasis. One is, it should not be more, it should not be less. So this study has been identified, this chemical helping the cell, producing the hyaline membrane disease like a surfactant, even though it is beneficial helping the surfactant. How best we can utilize in a clinical trial in future, it needs some more studies, research in this one before we utilize this one. But it gives a wide open data for the pharmaceutical company, find out the effective of these, finding out the new medication for the beneficial effect of these, removing this layer of this hyaline membrane, what has been produced by the hyaluronan.
All right. Doctor, I just wanted to know from you whether this particular jelly, whether it is usually found in the lungs or whether it is only in a case where somebody gets COVID-19 that you have this gel getting accumulated in the lungs, because the research is clearly saying that this gel that has been accumulated in COVID-19 deceased, in those patients who have lost their lives, that gel is helpful. Is it normally available? Is it normally generated in the lungs, or is it only when you have COVID-19 that something like this takes place?
Yes, I think it is not it's normally produced in the body, to helping the joints and all these things, to helping the cells.
Right.
but not in the lung producing this kind of thing. It has been observed in the COVID-19. The virus have get more of a immunological disease process and the coagulation problems. And also these are all the steroids helping it. That is something is an inflammatory phenomena from the various chemicals are flooded into the lung. We call cytokines, chemical mediators.
Correct.
That is the produce interaction of these chemicals. Not been heard earlier in the lungs, as a matter of fact. The new thing for us also.
All right.
Yes.
So it is the first time that the jelly is being observed in the lungs. Now, if we were to talk a little more about this particular active ingredient that has been found in the jelly, I'm given to understand that it has the capability, to bind large amounts of water in its web of long molecules, and that, in a sense, is what forms the jelly-like substance. Researchers are also saying that it is this very process that runs riot, so much of it, in the lungs of those infected by COVID-19, resulting in the patient needing ventilator care and eventually, in the worst case scenario, dies from respiratory failure. So how do we really control its level? Because too much of it seems to be detrimental for any COVID-19 patient.
Yes, I think it is true what you rightly said about it. But how do you manage it? First of all, we have to give the oxygen. Patient need oxygen. How do we give the oxygen, as you rightly pointed out? Give the oxygen under, we always take normally 20% oxygen. We give it 30, 40, 50, 60, 100% give oxygen. If it doesn't work, give the oxygen with pleasure. Nature, we have a breathing, people who need oxygen, they grunt like. So when you're breathing out, you create an end expiratory pressure so that more oxygen will absorb. Okay. This is nature's way. That's why we give the CPAP is produced because of the grunting nature's way what is produced. If also giving oxygen under pressure it works, you have a mechanical ventilator. You control the volume of the area, how much you are giving, volume oxygen, how much you are giving, what is the time gap you have to keep it. And also, if it doesn't work, ECMO, extracorporeal membrane oxygenator, where we give the oxygenation earlier, giving the lungs rest until it heals completely. This is the one we have to use it. Meantime, giving the surfactant, we have to look into this. Some of the people who have done the ARDS situation, they can use sometimes, we can use the surfactant as a chemical available, giving the air sacs open to absorb the oxygen much faster.
All right.
Yes.
All right. So there are a couple of ways of dealing with it in case if there is too much of formation of that jelly in the lungs. But yes, on a closing note, how hopeful are you, Doctor? You're an expert in the field, so yes, everything needs a proper check. You need to have clinical trials that must take place. But based on your experience, how hopeful are you of this particular jelly replacing plasma therapy?
I think there is no relation to plasma therapy. It's given up as a matter of fact. And also, this may not able to come so because normally it's not produced in the lungs that high. Recently, we found out about it. And I'm an optimist as a matter of fact. I always look for something going to come there. I'm hopeful, confident. And once the ARDS, no matter who will take care, which place is taking care, how much your money spent, mortality is over 50%, no matter what you do it. That is something we have to watch for it. Do your best sincerely. Hope for the best. I think looking forward, the better chemicals coming forward, keeping the lungs open, avoid these chemical barriers getting formed in the lungs.
Well, many thanks, Dr. Paramesh, for joining us and for sharing with us your insights on this new research that has indicated that a certain kind of jelly that is found in the lungs of those who have died due to COVID-19 may as well prove to be helpful in devising new therapies to go ahead and treat those who may be facing a severe amount of COVID-19 infection and also its effects as well. So yes, it is at this point in time in a nascent stage. We'll have to wait, as the doctor rightly pointed out, for the right kind of clinical trials to be conducted and for us to really understand as to how effective could it be and whether it has any kind of a side effect as well. So yes, time is what it will take before we understand more about this particular jelly. But yes, up until then, do not give up on any of your precautionary measures. Make sure hand hygiene is at the top of the order, and yes, maintain social distancing and stick to Namaste. If you like the information that we've dished out today, this evening, do not forget to like, share and subscribe to News 9 on YouTube, Facebook, Instagram and Twitter. Many thanks for joining us.